Hi, this is Mary Brookings with McMahon Pharmacy, and we're here again today with Hayford Warner with a new topic. We're going to be discussing vitamin D. So, Hayford.
Actually, that's one of my favorite topics, vitamin D supplementation. Vitamin D is extremely important for prevention and treatment of glucose intolerance, diabetes, high blood pressure, proper immune function, and it may actually promote weight loss if kept at optimal levels.
Great. So why are so many people deficient in vitamin D?
Well, supplementation is probably necessary if you want a decreased inflammatory response, normal muscle function, reduced risk of falling, and prevention of osteoporosis. Quest Diagnostics, the largest medical testing lab chain in the world, says that 77% of their vitamin D tests come back either inadequate or suboptimal. Now, vitamin D is synthesized in the skin using ultraviolet B rays from sunlight as the energy source. Our indoor lifestyles have led to an epidemic of vitamin D deficiency. Taking vitamin D levels is an easy add-on to your routine lab work. At your next doctor visit, ask them to check your vitamin D levels.
Okay, so is just taking my multivitamin enough vitamin D, or what is the proper amount of vitamin D to take?
A multivitamin is almost never enough to affect vitamin D levels. You seldom, if ever, see a change in vitamin D levels with 2,000 units or less per day. I usually recommend 5,000 international units per day per person for an adult. A lot of patients require up to 10,000 units a day to keep optimal levels. Optimal means 50 nanograms per mil or greater. You'll see that on your lab results. It's very important to take the active form of vitamin D, which is vitamin D3. And yes, it is possible to overdose on vitamin D, but there has never been a patient in the United States with vitamin D toxicity that was taking less than 40,000 units a day.
Great. So is there anything else that we should know about vitamin D?
Remember, the Mayo Clinic says that good levels of vitamin D are necessary for prevention of cancer, improved cognitive function and prevention of Alzheimer's disease, decreasing the risk of multiple sclerosis, decreasing the risk of infection, decreasing the risk of depression, and it improves weight loss when used in conjunction with diet and exercise. Feel free to seek us out here at McMahon Pharmacy to ask questions about a personalized vitamin D supplementation.
Thank you, Hayford. And we thank you for tuning in, and we will see you next week. Have a great afternoon.